Good morning. I'm Dr. Jeralyn Brossfield. I'm an OBGYN and a certified health coach, and for the past 4 years, I've been the director for our hospital's Wellness Institute. 7 years ago, when I became a coach, I was heartbroken. Esty had been to my office over and over to lose weight, and about every 2 months she would come in, we would sit down again. I spent a lot of time with her. I wrote out plans, I told her what to do, and she would go and try. And she would come back, and she would have failed. And months turned into years, and Esty lost her life. And I thought, I can't be a doctor. I don't know how to do this. And so when I became a health coach, I learned a system of predictable transformation. And in less than 2 months, I had patients who were having incredible success, and their hope and their success reignited my passion and purpose as a doctor. And I knew there was a way. That confidence and that personal transformation for me then allowed me to move forward, so that 4 years ago, I began our wellness programs at our hospital. And as I began to implement our employee wellness program, I copied from the best. I took our Take Shape for Life structure and built it into our hospital wellness program. And so we built one-to-one coaching with some of you in the audience. Dick and Shauna and Sarah became our coaches for our clients at the hospital. And one-to-one, eyeball to eyeball, they sat down with our employees and said, what matters most to you? And that structure of one-to-one coaching and curriculum built around the habits of health, and slowly building a community and a culture of health in our hospital, has transformed our employees' lives. So 4 years in, yeah, big claps, but we can clap at the end. Don't do it now. I want to talk more. But 4 years in, now we're collecting data and looking back at it. And so this year, when we did our biometric testing that we do annually, an employee that I'll call Jeff, Shauna, he's one of your clients, he rushed in and he was so excited. He couldn't wait to get to the testing, which a lot of people kind of dread. But he couldn't wait to get there and say, I'm 65 pounds down towards my goal, and yes, I've got another 65 to lose, but I'm on my way. And I can climb the mountains again. And he also said, he's in payroll, and he thought that people think that he can change whether things are deducted from their paychecks, which is part of the whole wellness program. And so they come to him to moan and groan about having to do wellness. And now what he's telling them is, wait, give it a chance. You're gonna get to choose. Nobody's gonna force you. You're gonna get to work on what matters to you, and you might change your life. And so, just like Jeff has changed his life, our employee culture is changing. And we're looking at the data, and what's incredible is our health claims are going down, and our stress claims are going down in our hospital. And what's most correlated with that is the amount of touches with the coach. So the more one-to-one, the more phone calls, the more talking, the more messages from our coaches, the better our employees do. That's powerful. That's you, right? That's what we hold in our hands as OptaVia. We are able to be the most effective agents of transformation with our clients. And the way that the change happens is one-to-one, eyeball to eyeball, heart to heart. Thank you.
Dr. Jeralyn Brossfield.